Healthy teeth and gums for a lifetime? How important is it? At Complete Health Dentistry of Northeastern Pennsylvania, that is our focus. If your mouth isn't healthy, your body can be affected as well. Gum disease has been linked to heart attacks, strokes, and diabetes. And if your teeth and gums are in bad shape, it affects your ability to smile, eat, and live life to the fullest. You've worked hard. Isn't it time to take care of yourself? Turn to Dr. Michael Rogers at Complete Health Dentistry, where you and your health are our number one focus. Take time for your health. Call Complete Health Dentistry at 253-5000 and schedule your new patient experience today. See how we can help you feel and look better than you ever thought possible.
Complete Health Dentistry, transforming your health for a lifetime.
Visit us on the web at Complete Health Dentistry of NEPA.com.
Complete Health Dentistry, transforming your health for a lifetime.
Welcome to Complete Health with Dr. Mike Rogers. I'm April, your host. We are here today to talk to you about a topic you wouldn't expect your dentist to be discussing: lung cancer. Welcome, Dr. Rogers.
Good morning, April.
This past week was the Great American Smokeout, and this month is National Lung Cancer Awareness Month. My dad was a heavy smoker and passed away at the young age of 58. And I know this topic touches very close to home for you also. Can you let our listeners know why this is such an important topic for you?
Well, yes. My dad was a heavy smoker for years. And 25 years ago, pretty much to last week, it's been since he passed away of lung cancer at age 65. The thing is he had just retired from his job. It wasn't that long after that he had passed. The hardest part was watching him, this strong, hardworking man, in a matter of months, deteriorate so rapidly. And I watched his symptoms increase to the point where every bone in his body hurt just to move. From diagnosis to his end was pretty much just 5 months. He lived in denial for quite a long time before he went to his physician. And when he did finally get there and was diagnosed with lung cancer, his options were very limited. I was brought up in a home where both of my parents smoked, and it wasn't unusual to smoke in the car for them and with all of us. And I still have concerns that the effect of all that exposure at such an early age, that secondhand smoke, can affect my health long term. I've done extensive research on how the warning signs enable me to catch it early if it does happen, and I want to share that knowledge with you guys, all of you out there today.
So can we start with what is lung cancer?
Yes, lung cancer is the uncontrolled growth of abnormal cells that start off in one or both lungs, usually in the cells that line the air passages. Lung cancer mostly occurs in people who smoke.
What are the first signs of lung cancer?
Well, primary symptoms usually show up like a cough that doesn't go away for 2 or 3 weeks, long-standing cough that gets worse, persistent chest infections, bronchitis, pneumonia that won't go away or comes back, coughing up blood or rust-colored spit, an ache or pain when breathing or coughing or laughing, shortness of breath, persistent tiredness or lack of energy, loss of appetite or unexplained weight loss, new onset of wheezing. Some less common symptoms, changes in the appearance of your fingers, such as they become more curved or the ends become larger, known as finger clubbing.
If only you can see him demonstrating that.
High temperature, fevers over 100.4, difficulty swallowing or pain when swallowing, wheezing, hoarse voice, swelling in your face or neck, persistent shoulder, chest pain.
So what are the symptoms if the lung cancer has spread outside of the lungs?
Well, things, if it's spread to other organs, then you can have bone pain, back and hips, nervous system changes, headaches, weakness, numbness in the legs, arms, dizziness, balance problems, seizures due to spread to the brain or spinal cord, Following that, there's yellowing of the skins and eye, called jaundice, from lung cancer spreading to the liver, lumps near the surface of the body due to cancer spreading to the lymph nodes. And if you feel you've got any of these symptoms, and even though you can have some symptoms and they're not truly lung cancer, if you feel you have any of these symptoms or a group of these symptoms, please contact your physician immediately.
Can lung cancer cause other problems?
Yes, it can. It can cause syndromes, which are groups of specific symptoms. And some of these syndromes are known as Horner's syndrome, superior vena cava syndrome, paraneoplastic syndrome, which some of these are known as a syndrome of inappropriate antidiuretic hormone, Cushing's syndrome, nervous system problems can also be part of it. High blood calcium levels can be caused, blood clots, and even excessive breast growth in men called gynecomastia.
So are there other types of lung cancers?
Yes, and most of these are not linked to smoking, and they include lung carcinoid tumors, mesothelioma, which is linked to asbestos.
You hear about that all the time in the commercials.
Found in the lining of the lung. Rare tumors such as sarcomas, lymphomas, adenoid, cystic carcinoma, and then metastatic tumors that have spread to the lungs. They're not truly considered lung cancer because the cancer started somewhere else.
Okay. How does lung cancer develop?
Well, first, the changes must take place in a cell or a group of cells that lead to uncontrolled division and growth. It takes about 30 divisions for one cancer cell to create a 1 centimeter tumor. That's about a half inch. And this is usually the smallest size that can be seen on an X-ray.
So it could be pretty serious before you even see it.
Right. It takes about 3 to 6 months for most lung cancers to double in size, and it can take several years to reach the size that can actually be diagnosed on an X-ray.
Wow. So we know that lung cancer is the number one leading cause of cancer deaths for men and women in the U.S., and over 200,000 cases diagnosed each year. There's a 56% 5-year survival rate when the disease is still localized in the lungs, and 16% of lung cancers are diagnosed at an early stage. And unfortunately, only a 5% survival rate when the cancer has spread to other organs. And more than half the people diagnosed with lung cancer die within 1 year of being diagnosed.
That's staggering.
When we come back, we'll talk about early diagnosis.
Complete Health Dentistry.
Hi, this is April from Complete Health Dentistry of NEPA. November is both Diabetes and Pancreatic Cancer Awareness Month. Did you know that the health of your mouth can directly affect the health of your body? Medical studies show that periodontal disease is directly related to both diabetes and pancreatic cancer. And since your pancreas's main function is to aid in digestion and sugar metabolism, all three, periodontal disease, diabetes, and pancreatic cancer, are interrelated. Call to make your appointment today to keep you and your gums healthy for a lifetime. 253-5000. If you are looking for a dentist that does more than just a cleaning, looks at the mouth as a gateway to the rest of your body, then Complete Health Dentistry is for you. 253-5000.
Complete Health Dentistry. Transforming your health for a lifetime.
Welcome back to Complete Health with Dr. Mike Rogers. Dr. Rogers, before the break, we talked about some staggering statistics on the mortality of lung cancer. I know you're very passionate to change these statistics and increase an individual's chance of survival. What type of tests are used to detect lung cancer?
Well, imaging tests such as X-rays and CTs are used. X-rays are used to detect abnormal mass or nodules. CTs can reveal small lesions in your lungs that might not be detected on an X-ray. Sputum cytology, looking at sputum or spit under a microscope, sometimes reveal cancer cells. A tissue sample or biopsy, the cells can be analyzed or analyzed in a lab to determine what type of lung cancer there is.
Are there tests to tell how long lung cancer has been growing or when it started?
Currently, there aren't any tests to determine that.
How about how fast does cancer grow or take to spread?
Well, the rate of cancer growth varies from person to person and also between the types of cancer. Lung cancer is a very fast-growing and early spreading type of cancer.
So I've seen billboards stating to take a survey if you smoked, and it could be life-saving. Any idea what this is about?
Yeah, I saw this. I saw those same billboards, and what it is, it's alerting people who have a high or increased risk of developing lung cancer to get it checked. Now with the ability or the availability of low-dose CT scans, people over 55 who smoked, usually heavily for years, but are otherwise healthy, should be evaluated this way to detect cancer at its earliest possible stages. This is sometimes something to discuss with your physician.
Well, that's great news. Any idea how you can take the survey?
You can do a Google search and just type in "saved by the scan," and this will bring you to screening survey to determine if you're a candidate for the test. And I'd strongly advise people who fit the criteria, if you do take the test, to do the CT because early detection is best.
Great advice. Can you get lung cancer if you never smoked?
Yes, you can. As many as 20% of people who die from lung cancer never smoked or used tobacco products at all. This translates into about 30,000 Americans every year.
Oh, that's staggering, especially if they don't smoke.
Exactly. So staying away from all forms of tobacco and secondhand smoke is very, very important.
What are the potential sources of cancer for these people then?
Well, radon gas is one source, and that's found in our house or in houses. 21,000 deaths and about 2,900 never smoked. Secondhand smoke causing about 7,000 lung cancer deaths every year in adults. Cancer.
That one is so frightening because you have no control over it at all.
Exactly. Secondhand cancer-causing agents, exposure to carcinogens like asbestos, diesel exhaust, some petroleum products, cadmium, chromium, nickel, uranium. All these things can cause cancer. Air pollution, both indoor and outdoor, and genetic mutations are all parts that people who never smoke can get lung cancer.
Well, what causes most non-small cell lung cancers?
Well, tobacco smoking is the leading cause of lung cancer deaths. Approximately 80-90% of lung cancers are being caused by smoking, and many others due to secondhand smoke.
Can you go into the stages of lung cancer, Dr. Rogers?
Sure. The stages of non-small cell lung cancer uses the TNM system, meaning, and it stands for tumor size and location, node development, and metastases, which means spreading.
T for tumor size and location, N for node involvement, you said?
Yes.
And M for what?
Metastasis.
Okay.
Which is spreading. It goes to distant organs.
Okay.
And the levels go at occult stage, where the tumor is so small it can't be seen, but it may be detected in spit or sputum. Stage 0, the tumor is very small, and in the superficial lung tissue, it hasn't spread deeper into the lung or outside the lung. Stage 1, the cancer is found in the lung and hasn't spread out of the lung. Stage 2, the cancer is found in the lung and nearby lymph nodes. Stage 3, the cancer is found in the lung and lymph nodes in the middle of the chest. And there's actually broke down into 2A and B, 3A and B, where the lymph node, the cancer is found in the lymph nodes on the same side as the cancer, and then the cancer is found in lymph nodes on the opposite side of the chest or above the collarbone. And then stage 4 is the cancer spread to both lungs, and the area around the lungs, or to distant organs, or metastasized.
That was the stage that your dad was in when he was diagnosed, right?
Correct.
What are the treatments once you find out that you have lung cancer? What are the treatments for it?
Well, there's surgery. Surgery is a usual treatment source. And the type of surgery depends on the size and location of the tumor. If it's only small, they may be able to do what's called a wedge resection, which is removing a small portion of the lung. If it's a little bigger, a segmented resection, which is they remove a little more than just a small portion, but not a whole section or lobe. A lobectomy, which is removal of a lobe of the lung, and then a pneumonectomy, where they remove an entire lung.
So you can actually survive without a lung.
Yeah, it's radical surgery, but yes, you can, and it limits you on a lot of things you can do. Life expectancy isn't as great as if you had both fully functioning lungs.
Are you then tethered to oxygen?
Yes, it does help, because you're going to be limited on your airway issues. Another treatment option is radiation, which uses high-powered energy beams to kill cancer cells. Chemotherapy, which is drugs or a mixture of drugs delivered either by IV or through the mouth orally to kill cancer cells. Radiosurgery, which is intense radiation treatment that aims beams from many angles at the cancer. And then targeted drug therapy. And this is a treatment where drugs focus on specific abnormalities of cancer cells, and it kills them. And then immunotherapy, helping your immune system to fight the cancer cell by blocking the cancer's ability to produce the proteins it makes, rendering our immune systems ineffective. In essence, causing the cancer cells not to be recognized by our body's defense systems.
So, Doctor, we have young people coming into our office who are now vaping. They seem to be of the belief that it's a healthier alternative. Is it really a healthier alternative? And what are your thoughts on this?
No, it's not a healthy alternative. And let me just kind of start with a background on what vaping is. The vaping unit, or the e-cigarette, electrically heats up nicotine, flavoring, and other chemicals, turning it into a vapor, which contains many cancer-causing chemicals. And they are inhaled then deep into the lungs by the user. The chemicals include formaldehyde, heavy metals, and all kinds of other particles.
Isn't formaldehyde an embalming fluid?
Yes, it's part of an embalming fluid, and many of the flavors also contain a chemical called diacetyl, and this has been linked to what's called bronchiolitis obliterans, also known as popcorn lung.
Is that a form of lung cancer?
No, but it's a form of lung disease which affects your ability to breathe. And this chemical scars the tiny air sacs, or the alveoli, in your lungs, and it can also make the airway thick and narrow.
Are there symptoms someone who vapes should watch out for?
Yes, there are. The symptoms contain shortness of breath, wheezing, headache, fever, body aches, and all kinds of other problems.
So your advice, obviously, is to not vape.
Yes. I mean, since vaping doesn't have a long history, so we don't have a lot of literature and studies behind it, we don't know yet what the long-term side effects are going to be and the damage this is going to cause to people. In essence, our kids are test subjects for this vaping, and we won't know for years.
You've been listening to Complete Health with Dr. Mike Rogers. When we come back, we will discuss the relationship between oral health and your mouth and lung cancer.
Complete Health Dentistry, transforming your health for a lifetime.
Do you have unused dental insurance benefits or flexible spending left for 2018? Did you know that dental insurance benefits and flexible spending have a use it or lose it policy? 2019 is right around the corner. Benefits not used this year do not carry over to next year. Call Dr. Michael Rogers today to schedule your appointment for a wellness visit, treatment, or a new patient experience to take advantage of your unused benefits. Call 570-253-5000. Appointments are limited and filling up quickly. Visit us on the web at CompleteHealthDentistry.NEPA.com.
Complete Health Dentistry, transforming your health for a lifetime.
Welcome back to Complete Health with Dr. Mike Rogers. Dr. Rogers, is there a relationship between oral health and lung cancer?
Great question, and the answer is yes. Just this year, January of 2018, a study was released by Tufts University School of Medicine and Johns Hopkins Medical, where they found an associated increased risk in lung cancer in people with gum disease or periodontal disease, and also in people who were edentulous. And what that means is people with no teeth. In this study, there was almost a 24% increase in lung cancer in people with severe periodontal disease and an increased risk of 28% in people with no teeth. Other cohort studies indicate that also this year indicate that oral bacteria in our body's inflammatory immune response to these pathogenic oral bacteria does increase the risk of lung cancer. And they have not identified the specific bacteria in these studies yet, but I'm sure more studies are going to be coming out because this is significant.
So how do you think this can happen?
Well, let's look at it. People with periodontal disease not only have an increased bacterial concentration of bacteria in their mouth, but also in their bloodstream, caused by this bad pathogenic bacteria seeping into it, almost leaching into it, because it's only one cell layer away. This is called a systemic oral bacteremia. It causes our immune systems to become overtaxed and exhausted, and in defending these bloodstream and mouth infections, not to mention if our defense systems have to fight other diseases within our bodies. With our defense systems depleted, and if cancer can cause our immune systems not to recognize these cells, as we discussed earlier, it's very easy to see that these aggressive opportunistic bacteria and cancer cells together can multiply and grow and spread very rapidly and easily.
That's frightening.
It is.
Why do you think there's an increase in risk of lung cancer in people without teeth?
My thought is that even though a person may have lost their teeth or have no teeth, if the reason for tooth loss was because of periodontal or gum disease, that very aggressive bad bacteria that our bodies were fighting is still living deep in the tissues. Just because the teeth aren't there, the bacteria is still in our mouths. And it can get into our bloodstream, as we just discussed very easily, spread to organs all over our body. We've discussed in the past that we find it all over. And many times people have lost all their teeth or at a more mature age, so our immune systems are depleted to begin with. Studies show people on average live about 10 years longer. People with teeth on average live about 10 years longer than people without. And I believe this is a prime example of that.
Very interesting.
You know what? Let's change gears a little bit from that and talk about some prevention since we're running out of time.
Okay. Well, is there a diet you can eat to reduce the risk of lung cancer?
Well, it's recommended that a healthy diet filled with colorful fruits and vegetables along with lean protein and omega-3 fatty acids can help reduce your risk of lung cancer.
Do you have specific recommendations for what we should drink and eat to keep our lungs healthy?
Yes, water. Water is best to drink, and plenty of it. We need moisture to keep our lungs healthy and moist. Green tea with lemon, which increases the absorption of the green tea, is an antioxidant. Fatty fish, high in omega-3 fatty acids, is good. Garlic and onions. Studies show that 2 or more times a week of garlic can reduce lung cancer up to 44%. Spinach, which is rich in folate, can increase or reduce the risk of lung cancer up to 40%.
I know what we're having for dinner tonight.
Yeah, I guess that's why Popeye always smoked a cigar and ate spinach. Apples and apricots contain flavonoids. Broccoli, cauliflower, and other cruciferous vegetables contain glucosinates, which can reduce lung cancer between 21 and 32%. Poultry, chicken, and turkey contain lots of vitamin A, which helps boost our lung health. And some studies show that our bodies absorb the animal-based vitamin A better than the plant-based. Walnuts contain omega fatty 3 acids, which are good. Beans, kidney, pinto, black beans, etc., all good sources of antioxidants. Berries such as blueberries, cranberries, grapes, strawberries, acai berries, also rich in antioxidants. Butternut squash, red peppers, wheat germ, spices such as rosemary, sage, parsley, and oregano. There's a lot of stuff out there that can help keep our lungs healthy.
So along with a great diet, what are some other prevention recommendations that you have?
Don't smoke. That's number one. Obviously, 90% of lung cancers are that. If you do smoke or vape, stop. If you don't smoke or vape, don't start. Avoid secondhand smoke. Test your house for radon. Avoid carcinogens at work and at home. Eat a diet full of fruits and vegetables. Exercise regularly. Eat a healthy diet. Treat your dental disease, cavities, and periodontal gum disease. Limit sugar intake because it feeds the oral bacteria and the cancer cells, making them stronger and they can spread easier. Control your diabetes if you have diabetes.
Can you give some suggestions for people who are going through cancer treatments?
If you're going through cancer treatment, here are some ideas, because some types of chemotherapy can affect white blood cells and red blood cells and platelets, and this can affect the lining of your mouth, creating mouth sores. Certain types of radiation can cause pain and stiffness and even cavities due to dry mouth. Brush your teeth and gums. Don't forget the roof of your mouth and your tongue after every meal, snacks, and before bed. Floss daily. Eat well to nourish your body. Skip spicy and acidic foods. Don't smoke. Avoid alcohol, because this can irritate the tissues. Suck on ice chips. Don't chew them, just to keep your mouth moist. If need be, we can prescribe oral rinses and salivary substitutes. Avoid mouthwashes with alcohol. Fluoride treatments are a great adjunct to prevent decay due to increased dryness in your mouth. We can make special trays to deliver the fluoride to prevent cavities. Exercise your jaw if you get radiation therapy. At least 3 times a day, open and close as far as you can, as long as there's no pain, for 10 to 20 repetitions a time. This will help prevent muscle stiffness in your jaws.
What great information, Dr. Rogers. You've been listening to Complete Health with Dr. Mike Rogers. We have covered a lot of information regarding lung cancer. Did you know tobacco products contain more than 7,000 chemicals and at least 70 are known to cause cancer? When you inhale tobacco smoke, the mixture of chemicals are delivered directly to your lungs, where it immediately starts causing damage. These chemicals also enter your bloodstream and are carried throughout your body, increasing the risk of other cancers. Former smokers are still at risk of developing lung cancer. Quitting can lower that risk. Within 10 years of quitting, the risk of dying from lung cancer drops by half. Our advice today: if you smoke, please quit. If you're thinking about smoking, please don't.
Complete Health Dentistry, transforming your health for a lifetime. Complete Health Dentistry.
Hi, I'm April at Complete Health Dentistry of NEPA, wishing everyone a happy holiday season. As a culmination to our 25th year in dentistry, we invite you to our special holiday open house at our office on Route 191, Honesdale. This event is Thursday, November 29th from 6 p.m. to 8 p.m. If you are a patient, a former patient, or if you are thinking about becoming a patient, we welcome you. If you've never been here before, stop in, see our office, and Dr. Rogers and our Complete Health Dental team. Take this opportunity to see what we have to offer. Bring a friend. We will have live music, plenty of refreshments, door prizes, and a free gift to everyone attending. Please call 253-5000 if you have any questions. Thursday, November 29th. See you there.
Complete Health Dentistry, transforming your